Gretchen Jimenez. I'm a student physical therapist. Is it all right if I work with you today? Okay, awesome. So today I'm gonna be performing an abdominal exam, and with that I'm just gonna be looking at your stomach, assessing it, and also listening to your stomach as well. Okay. All right. So to start off, I'm gonna go ahead and put this pillow underneath your legs just to help you feel more comfortable. Okay. So can you go ahead and lift your legs up for me? And then go ahead and relax. Is that okay? Would you prefer something else, or is that pillow all right?
That's good.
Okay. All right. So now I'm going to go ahead and lower the sheet down. Is that all right with you? Okay. And then I'm going to go ahead and lift up your shirt. Is that all right?
Yep.
Okay. And then I'm going to go ahead and tuck that towel that I have over here underneath your sports bra. Is that all right?
Yep.
And then I'm going to tuck that sheet into your pants and lower your shorts a little bit just so I can see your hip bones. Is that all right?
Yep.
Okay, so like I said, I'll be performing an abdominal exam. With this, I want you to just stay relaxed the entire time and comfortable. And if at any point you have any pain, I want you to let me know. But do you have any pain right now?
No.
Okay, good. So first I'm gonna just start off by taking a look at your stomach, okay? So I'm just looking at her stomach, looking at the general contour of the abdomen, looking for any protrusions, scars, striae, or any vascular abnormalities. All right, so next I'm gonna start off by listening to your stomach, and I'm just gonna be listening for some bowel sounds, as well as for some vascular sounds as well, so listening to your arteries. So I'm going to start off by listening with the diaphragm for the bowel sounds, and the arteries I'm going to listen to the bell, where I'll be listening for bruits. So I'm going to start off in the right upper quadrant. Okay, so I heard 5. Okay, 5 more. Okay. And then 5 more. Now, I'm gonna go ahead and listen to her arteries. Start off with her aorta. Is it all right if I palpate for or feel for a bone on your chest? And then I'm finding the aorta, which is in the middle between the xiphoid and the umbilicus. And so again, I'm listening for bruits, and then I'm gonna move on to the renal. Then I'm moving on to the other renal, which these are about 2 centimeters lateral to the aorta. Okay, and so next, is it all right if I palpate or feel for some bones on your hips? Okay, so I'm feeling for her ASIS and looking at her umbilicus. Then I'm gonna go 2 centimeters lateral and inferior towards the ASIS, where I'm listening to the iliac artery. Okay, same thing on this side, ASIS, umbilicus, about 2 centimeters lateral and inferior towards the ASIS. All right, still doing okay?
Yep.
Okay, awesome. So now I'm just gonna be listening to some sounds over your stomach, and so I'll be applying some tapping over your stomach, okay? So I want you to just stay relaxed. So I'm going to be performing percussion in the 4 quadrants, starting with the right upper. And so with this, I'm looking for the size and location of the intra-abdominal organs. So that was the left upper quadrant. left lower quadrant. And right lower quadrant. Any problems with that? No. Okay, good. So now I'm just going to be feeling in different areas of your stomach. I'm gonna start with some light touch, and then I'm gonna move on to some deeper pressure, okay? Mm-hmm. So I want you to go ahead and stay relaxed. So now I'm doing superficial palpation, where I'm testing the mobility of her tissue as well as the compliance. So this is the left upper quadrant. I just did the right upper quadrant. Moving to the left lower quadrant and the right lower quadrant. Okay, all right. So next I'm going to be applying a deep pressure in the middle of your stomach. I want you to let me know if you have any pain with that, okay? So I'm feeling for the pulse of the aorta. So once I feel it, I can go feel for the width. And so I can't feel it, so I'm going to come in just a little bit. And here I am able to feel it on both fingers, so I know that is the width of her aorta. All right, so next I'm going to be applying a deep pressure all along your stomach. Let me know if you have any pain. Okay. So I'm applying deep pressure in her right upper quadrant, looking for the intra-abdominal organs to see if she has any pain. So now I'm feeling the liver, which is about mid-clavicular line under the costal margin. So that was the liver. Now I'm going to perform deep palpation on the left upper quadrant, and I will be feeling her for her spleen, which is under the costal margin as well in the left upper quadrant. Now moving on to the left lower quadrant. Again, just applying a deep pressure. And then right lower quadrant. How are you doing? Good. Okay. All right. So we're almost done. I'm going to go ahead and feel for your hip bone again. And so I'm coming halfway in between the umbilicus and the ASIS. And I'm going to apply a deep pressure right here. Let me know if you have any pain. So this is McBurney's point. I'm going to apply a deep pressure, pushing my hands straight downwards, and then I'm going to go ahead and release. Did you have any pain or tenderness with that? No. Okay, good. And so I'm going to go ahead and move on over to the other side where I'll be doing Murphy's. So I'm going to apply a deep pressure on your right upper stomach. So I'm going to hook my hands underneath the costal margin. And then can you go ahead and take a deep breath for me, in and out through the mouth? Good. Any problems with that? No. Okay, good. So that concludes all of my testing. Thank you for working with me. Having any pain or anything like that? Nope.